So good afternoon, everyone. You enjoying the sessions?
Yes.
You ready to be hypnotized?
Yes.
Oh, very good. All right. So, sometimes we're going on through life. We tend to see life as a linear. We think about our careers, getting married, having children, grandchildren, retirement. And then life will throw something at us, and it's completely out of the blue. We're not expecting it. And probably the best thing that hypnosis brings to people with a diagnosis of cancer or people surviving cancer is actually it helps you to make that swerve, to avoid that obstacle, and to work with that obstacle with grace. So that's what I'm going to share with you. So has anyone here experienced hypnosis? How do I change the slide? Okay, has anyone here experienced hypnosis? Yes? No? Okay, so let me try asking you, you're still okay to try it, yes? So let me try asking you the question in a slightly different way. Do you drive?
Yes.
Okay, so as you're driving, you know that feeling that comes when you're driving along? You go into autopilot, you turn left, you're not really thinking about it, you turn right, you come to the red light, you don't go, this is a red light, I need to stop, you stop. It goes to green, and off we go, and we arrive at our destination, don't really remember the journey. Yeah, we can relate to this? Okay, it has a name, it's called waking hypnosis. So if you're nodding your head and saying yes, you're already experts at what we call the state of hypnosis. Excuse me just 1 minute. Sorry about that, my head's too small for the mic. Okay, so this state that we call waking hypnosis is very common, and we experience it several times a day. It's like meditation. Yeah? Can we relate to meditation? Anyone here meditate? Yeah? It's like prayer. It's like reading a good book and getting really absorbed in the book, or watching a movie and forgetting what's going on around you. So these are naturally occurring states, and they happen when we have a narrow focus of attention, like when we're focused on the road or the white line, and our body starts to relax a little bit, nothing to worry about. But if a motorbike cut out in front of us, if a child was there in the road, bang, we'd come instantly alert, wouldn't we? We would, wouldn't we? Yes? Okay. So it's a very safe state, even though your mind sort of drifts away. Your body starts to relax, your mind starts to relax, and we become a little bit suggestible. And that's where people start to worry a little bit. Suggestible, I have to tell you, is not gullible. All right? Doesn't mean just because you're going into hypnosis, I'm going to say, well, I wouldn't mind your PIN number, and you're all going to shout it out to me. You won't. Sorry, but you won't. You still remain in control. And it's like this. In the normal conscious state, generally what happens is somebody gives you some information, and you say, hang on a minute, I need to think about it, I need to understand it, I need to evaluate whether it's right for me, right? And if I do, then I'll contemplate it and maybe I'll make the change. In hypnosis, it's a little bit different. You go, sounds like a nice idea. Maybe I'll think about it. I wonder what it will feel like. What would that work for me? We're starting to imagine what it's like. And then you make the decision, yes, I'm going to do it, or no, it's not right for me. So the control stays with you, just as if when you're driving along, if somebody cuts out in front of you, instantly you come away. So the control is still there. And because you're turning around these ideas in your mind, you're thinking about them before you make the decision of what you are going to do or not do, learning becomes more efficient. Okay, so that's the state of hypnosis. There's another state that most of us know. Do we daydream? Yeah. Daydreaming is the closest thing that we do in the natural state to what we as clinical hypnotherapists do when you come to see us in the consulting room. We ask you to get comfortable. We have nice chairs. It's sort of like this, but they have leg rests. You lean back, you close your eyes because it's just easier to daydream with your eyes closed. Yeah? And we guide the daydream. So if it's someone who wants to lose weight, we guide the daydream to what it might be like to do that little bit of exercise that we've just learnt about, what it might be like to try the positive mindsets that Paul shared with us. We rehearse them, we mentally rehearse them, and while we're thinking about them, what happens is we learn them more effectively and more efficiently, and we create a sort of a predisposition to put them into practice. So that's how the state works. So let's look at the therapy. All right, there are a few things that we do with hypnosis. There's a part in our brain called the anterior cingulate cortex, and this part of our brain actually registers our response to suffering. And we can actually switch off the activity in this brain when we're using hypnosis. So you still have the sensation, but it doesn't matter so much. And then with hypnosis, you can also start So with hypnosis, you can switch down the response of suffering, and you can also reduce the physical feelings of discomfort. So it works on two different levels. It can deal with some of the side effects of chemotherapy and radiotherapy. It can deal with the stresses and the anxieties that we have when we have a diagnosis or when we're coping with cancer. We start to sleep better. We feel less tired. We eat better, it can reduce the hot flashes, and it can improve quality of life. So there's a whole number of different things that hypnotherapy can help with. And you know, there is always a stress response. Whenever we get a diagnosis, no matter what that is, we have a stress response. And the medical community globally is very well set up to talk about treatments, to talk about options, but they're not always so well set up to talk about how I'm feeling or how you're feeling. So a lot of patients all around the world look at different alternatives. They look at complementary medicine, they look at traditional alternatives, they look at ways to mitigate and deal with that anxiety and that stress that very often comes with the diagnosis of a serious illness. And clinical hypnotherapy is one of those modalities, one of those treatment options that works very well alongside mainstream medicine. Okay, and what we're doing is we're cutting into a cycle which can sometimes build up. We're looking at the stressors, the strong stressors. We're looking at the uncertainty that we feel. Suddenly our body is not responding in the way that we're used to. Sometimes we're having to cope with difficult decisions to make. Our quality of life changes. There can be a number of symptoms that we have to deal with. And even after treatment, sometimes these symptoms, the discomfort, the anxiety can persist. So clinical hypnosis can be used to interrupt the cycle and to break it down into easy, manageable chunks. So I'm going to run through very quickly a little bit of the research so you know I'm not making it up. And then we're going to look at how it feels like when we go into hypnosis. Should we do that? Yes. All right. So a little bit of research. There's quite a lot of research in the use of clinical hypnotherapy for cancer. And Montgomery, it's a large study done in America in 2012, and he found that 15 minutes of hypnosis for patients before they went to surgery had 87% benefit to his patient group. And the benefits was very wide-ranging. It came from reduce the pain, so patients were taking less pain medication. It reduced the side effects, the nausea. It reduced the hospital costs. In this particular study, it was $771 per patient. Patients reported having less pain. They said they had less nausea. They said they were less fatigued. And they also felt more comfortable. And patients themselves felt more positive about themselves and about the procedure. So quality of life also improved. Now, there was another study by Sheila, and he looked at the fatigue that can come sometimes when we have radiotherapy. And he found by using hypnosis, the fatigue levels dropped down by 32%. And the study is very exciting because it suggests that if we use clinical hypnosis before radiotherapy, what we may be able to do is to prevent the build-up of fatigue in the first place. So that becomes quite an exciting thing to know. And the secondary results that he had in his study was he was able to reduce the negative mindset just by taking patients in and out of hypnosis by about 66%, and to build up that positive feeling by about 43%. So what is this thing we're calling hypnosis? Generally, when a patient comes in to see a hypnotherapist, they can come in a small group, or they can come in on a one-to-one. And it starts off with a counseling. The therapist gets to know the patient, and the patient gets to talk about what's going on in their life. And then you're taken into a state of relaxation, a very nice sort of daydream, which we'll do in a little bit. And then the therapist will deepen it. And everybody goes into hypnosis in a slightly different way. Some people will get really deeply comfortable, and other people will sort of float at the edge. They're just happy to be there. And what the therapist will then do is he will use a particular form of language to install some of the things that Paul Jambunathan was talking about, some of those positive experiences, and to reinforce them, not just in the way that we think, but in the way that we feel and the way that we experience them. And we will try that out in a little while. And then, just before the patients are awakened, what happens is the clinical hypnotherapist will give some confidence building, some extra resources, some extra coping skills to be able to take into everyday life. Because after all, that's what we want, a little bit of extra. Right? And then you awaken the patient, and I have to promise you that no one in the history of hypnosis has ever not woken up. Everyone wakes up. All right. Now, there was another study by Stolpers, and he found that 23% of his group benefited, and very excitingly, every single person who experienced hypnosis said that they benefited sufficiently to recommend it to somebody else who was in their shoes. Okay, so that's quite a strong endorsement for the experience that patients have. I'm going to talk a little bit about hot flashes. This is a case study with a patient who was 69 years old, had prostate cancer, and was experiencing particularly severe hot flashes. And what they did was they just used hypnosis without medication for a 7-week period. It was a researcher called Elkins. And they were able to reduce the hot flashes by 94% during that period. And the patient also improved in his sleep quality by 87%. After the study, 12 weeks after the study, when all intervention had stopped, the benefit continued at about 38%. Now, Elkins uses the same protocol with breast cancer patients, and in this study, she worked with 51 patients who all had hot flashes of up to 14 or plus per day. And what she was able to do was to reduce the hot flashes by 68%. And also, secondary benefits were reducing the reported anxiety, the reported depression, and the interference of hot flashes, which was during the study and which persisted after the study. So, quite a lot of interesting things that clinical hypnosis can do, if we can get beyond the misconceptions, because there are a lot of funny stories out there about hypnosis. Am I right? Yes, I'm sure you've heard one or two of them. So, is it sleep? Well, it looks like sleep sometimes. It might feel like sleep, but it is not sleep. Yeah? It's just like when you're driving the car, somebody cuts out in front of you, child is there in front of you, I ask you for your PIN number, instantly you come awake. All right? You still remain in control. It's an altered state of consciousness, very similar to meditation. So, will I lose control? In fact, what's happening is you're associating more with your emotional side. You're associating more with your experiences. You're shaping your experiences, so you're tapping into your more positive experiences rather than your negative ones, but you are more associated. Therefore, you actually feel as if you're more in control. And after the experience, when you repeat it day after day, week after week, actually, patients report feeling more in control. And on the hospital locus of control scale, which is the measurement for how in control that we feel over our situation, there is a positive reading when we use hypnosis. Okay. What if I don't wake up? Well, we already know. No one in the history of hypnosis has ever remained in hypnosis. Will I have amnesia? You will always remember everything you need to remember. You see sometimes in the movies people doing all kinds of weird stuff and patients, clients, people having no memory. There is nothing that can be done in hypnosis that you yourself cannot reverse. All right? It's a little bit like driving the car. You don't remember every single second of it, but anything that's important and relevant to you, absolutely you can. So, it's an opportunity. Does anyone have a question you would like to ask me about misconceptions or about myths or strange things out there about hypnosis? I'm going to assume from that you all are very comfortable with this idea of hypnosis and nearly ready to go in. You're smiling at me. All right. So, this is what it looks like. This is my colleague in a light hypnotic state. About 90% of the population can enter the light hypnotic state. It's a little bit like a daydream. All right. In our consulting rooms, because we use specialized techniques, about 97% of our patients will enter this state. Basically, you close your eyes, you start to drift away, you sit pretty comfortably, don't really move, and breathing becomes more even, more regular, more relaxed, and the muscles in your face start to relax, and the muscles in your body do. And in fact, as you can see, all those sort of worry lines sort of just melt away. Okay. 70 to 90% of people who go into the light hypnotic state can actually go to a medium state of hypnosis. It's like having a really nice daydream. Generally, people who are experiencing 70 to 90% enjoy it. Sometimes they enjoy it so much they don't really want to wake up, but everyone does. So don't worry about that. And you kind of feel drowsy. Your body feels heavy and tired. You're just very comfortable. You're a little bit slumped in the chair. And this is the state where analgesia, that sort of comfortable feeling or a slight numbness about the body can start. And you also become a little less aware of your body, little bit less aware of what's going on around you, more focused into your inner world. And this is where the therapist will guide the direction of the daydream. About 15 to 20% of people can enter a deep state of hypnosis. In the 20-odd years that I've been teaching hypnosis, no one has yet fallen off the chair in this state, but the focus is actually into your inner world, and so generally people don't open their eyes. They feel very, very comfortable, and they respond very, very slowly. All right. And so generally we will not take a patient to this level unless we're going to do profound pain management or we're going to do surgery. There's no real need to do it. Okay. But I have to tell you, the nicest thing, given all the things we've talked about, the nicest thing about hypnosis is actually the feeling of relaxation you get. Okay? And it's not just a physical feeling of relaxation, it's also a mental feeling of relaxation. Now, this is kind of where I like to go when I'm relaxing. All right? It's New Zealand. I had an amazing holiday there. It's far, far away from the office. The air smelled fresh. There was not many people around. It was pretty, pretty nice. Now, I'm sure all of you can imagine a place that you might like to go. Can you? place where if you got to, it would be pretty peaceful. Maybe it was a favorite holiday. Yeah? Maybe it's your bed. Maybe it's somewhere that you haven't been to yet. But if you went, it would just feel amazing. You know it would, even though you haven't been. Yeah? Does anyone have a problem with that idea? No? Anyone have a favorite? Who has a favorite holiday that they can associate with positive, relaxing feelings? Can you just wave at me so I can see? Only one, I don't believe that. 2, 3, okay, 4, 5. All right, so what we're going to do is I'm going to invite you to think about this holiday. And if you don't have a relaxing holiday, maybe you could think about a place, your bed, a comfortable chair, that you just like to sit and chill in. Just for a minute, there's no hypnosis yet. Yeah? Or maybe it's somewhere in the future, somewhere you guys are planning to go. And you know when you get there, it will just be right. All right? Would you just close your eyes for 30 seconds? That's all I'm going to ask you to do, so I'm not doing any hypnosis, promise. And then, when you've got that image in your mind, just nod your head and come back here. Open your eyes, okay? All right, let's go. Let's give it a go. Okay, if you've got an image in your mind, just nod your heads and just come back here, open your eyes. Okay. Everyone able to do that? Yeah? Okay. So now would you like to go and visit that image using hypnosis? Yeah? All right. So all you have to do, and that's a nice thing about hypnosis, is I get to do the work, you get to close your eyes and just drift away. So make yourselves comfortable. So if you don't mind, switch off your handphones so we're not interrupted. Just make yourselves comfortable. Place your feet nice and firmly on the ground, on the floor. Lean back and feel the chair supporting your back. And in your own way, if you haven't already done so, just allow your eyes to close. And there is absolutely nothing important for you to do. Nothing to bother about. Nothing to worry about. Just to enjoy breathing in. And as you do, just breathe in that cool air. And just enjoy it. Enter your nose. Enter your body. Just feel that air enter your body and travel through you, just refreshing the inside of you. And as you breathe out, just breathe out that unnecessary, unwanted nervous tension. Just let it go. go out of your body. And there's nothing important for you to do except to allow your mind to drift away. Perhaps you'd like to imagine that place, that very special place for you. Where you can feel comfortable and relaxed. And the sounds of other people around you just becoming more comfortable, clearing their throats, settling down and leaning back. Just sounds. But your mind is free to drift away ever more easily, ever more naturally, to your own, very own, favorite place of relaxation. And I wonder where that place will be. Will it be somewhere that is completely special and unique to you? Maybe a favorite holiday, a place you enjoyed, where you felt free and comfortable. Maybe it's your very own bed or chair, your space where you feel most in control. In fact, it really doesn't matter. All you need to do is breathe in and feel that wonderful cool air enter your body. And as it does, notice the way it soothes the inside of you, allowing the muscles in your body to begin to relax. First the muscles in your feet and ankles. Just let them go. Deeper and deeper, more and more. And in a few moments' time, I'm going to awaken you. But just before I do, perhaps you'd like to take a moment to look around in your imagination. Just experience those details. The colors, the feelings, even the smells. Just breathe in again and take your last few moments to just really experience this experience. And then I'm going to awaken you. And the way I'm going to awaken you is very simply by counting from 1 to 10. And as I do, you find yourself more and more aware that you're sitting at the UM auditorium, more and more aware of the chair that you're sitting on. And you come back feeling fine refreshed and rejuvenated. It's a wonderful sense of having breathed in and allowed that wonderful cool air to just travel all the way down, 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 allowing your body and your mind to refresh and renew. And so, allow all those wonderful parts that make you to be back together again. As I count from 1 to 10. 1, 2, 3, waking up. 4, 5, 6, waking up. 7, 8, open your eyes. 9, 10, wide awake, wide awake, wide awake. Give yourself a good old stretch. 1, 2, 3, waking up. 4, 5, 6, waking up. 7, 8, open your eyes. Wide awake, wide awake, wide awake. That's it. Give yourself a good old stretch. 9, 10. Good morning. Good morning. Does anyone have any question or any sharing from that? Okay, thank you very much. I would just like to share that what you experience is a very light, very beginnings of what hypnosis feels like. Right? Everyone woke up, everyone's fine, and sadly, no one gave me PIN numbers, wallets, or anything that was interesting or exciting. All right. Thank you very much for your time.